Hello dear learners. Today we discuss about the patient non-compliance. Patient non-compliance is the failure of the patient to obey instructions for administering the medications as directed, thus resulting in low response of treatment than expected. But question arises why there is a patient non-compliant. There are the different reasons behind this, like lack of belief in treatment, lack of awareness or information, complexity of disease, inability to pay for medications and many more. In this video, we discuss about the meaning of patient non-compliance and different factors which are responsible for non-compliance. Let's begin with this. But before that, you must know about meaning of patient compliance. Patient compliance can be defined as the extent to which a patient takes or uses his medication in accordance with the intention of the medical or health advice given. And because of patient compliance, it have a great importance in determination of therapeutic outcome. The effectiveness of treatment get increased because of the patient compliance. But what is patient non-compliance? So patient non-compliance, which is exactly opposite to that of patient compliance. If a patient is not taking the medicines as recommended or not following the treatment schedule as suggested by the physician, can be considered as non-compliant, or failure to obey and follow the instructions regarding health care including diet regimen, exercise and other lifestyle activities like smoking or drinking habits will also constitute for non-compliance, and because of non-compliance lead to therapeutic failure, which in some cases results in serious complications or even death. Example, like if a diabetic patient takes excess medicine prescribed or omits the doses, it may cause disease complications including life-threatening situations. Another example, like if an epileptic patient fails to take medicines, there is every chance for the reoccurrence of seizures. Now about which are the different factors which can lead to patient non-compliance. So here we discuss the general factors of non-compliance. So first one is types of disease or illness. The nature or type of illness can sometimes contribute to the non-compliance. Psychiatric patients may not have the ability to cooperate with the treatment and it leads to non-compliance. Or when the patients are asymptomatic or symptoms subside, it is difficult to convince the patient of the importance of drug therapy, and because of the symptoms get subside, he doesn't take the medicines and leads to non-compliance. If a patient feels better after taking the medicines, he may also feel that he no longer needs to take the medicines once the symptoms get subside. There are the different diseases where non-compliance becomes a major problem, which include cardiovascular diseases, diabetes, depression, arthritis, etc. Another factor, physical limitations. Many physical factors can affect the compliance. In certain cases, the distance can be a factor. The patient may have to travel a long distance to procure the medicines. For example, like inhalers like pressurized aerosol requires coordination between fingers and breathing, which requires proper training. If it doesn't have a proper training, then it leads to patient non-compliance. Next one is the therapeutic regimen. A drug regimen includes the dose, dosage form, route and frequency of administration and duration of therapy. It is often found that more complex the therapeutic regimen, the less will be the compliance. So we divide this in different way, like multiple drug therapy As the number of medicines a patient has to take increases, the risk of non-compliance also increases in direct proportion. Second one is the frequency and duration of dosing. The increase in frequency of administration of medication leads to non-compliance due to various reasons like forgetting to take or inconvenience to take at the same time. Next one is the adverse effects. The ability of certain drugs to cause sexual dysfunction as an adverse effect is a reason for non-compliance. Like antipsychotic and antihypertensive drugs will produce this side effect, and this leads to patient non-compliance because of the adverse effect which are seen while in the drug. Next one is the cost of medication. Cost of the medication is a factor for compliance or non-compliance in many cases. So more the cost, more is the chances of non-compliance. Next one is the taste of medication. The taste of the medication becomes a problem mainly with pediatric oral liquid preparations. Geriatric patients also behave in similar manner toward the taste of medicines. Like if the taste is bitter one, so chances of non-compliance gets increases. Next one is the administration of medication. Administration problem arise due to incorrect measurement or use of inappropriate devices. Some patients may fail to use meter dose inhalation properly and could result in inadequate control of the disease conditions. Next factor is religious beliefs. Religious belief can also affect compliance. It is mainly due to the materials used in the medicines. Alcohols, porcine insulin, gelatin capsules, shark liver oil are the examples of items that were avoided by certain religious people. As one is a social and psychological factor. The level of confidence a patient has in his doctor is an important factor in compliance. If the confidence is less, the chances of compliance with doctor direction is less, as the patient will doubt the effectiveness, and this is a major one for non-compliance. So because of the non-compliance, we have seen that the effectiveness decreases. Other than these factors, some factors are also contribute to the non-compliance like sex, age, education, knowledge, occupation, personality factors, etc. So we can decrease the patient non-compliance by different way, like the patient education, which is very important one. If you educate the patient regarding the use of drug, then which will be increase the compliance. Patient counseling which is a major factor for decreasing the non-compliance. Then use of a compliance aids like use of a sketches, drawing, audiovisual aids, written information, which will also increase the patient compliance. Here we discuss about what is patient non-compliance and the different factors responsible for the patient non-compliance and how to avoid all these patient non-compliance we discuss. Hope all of you getting this. Thank you and happy learning.